All right, so I'm excited to have Dr. Joseph Zelk with us today, double board certified in sleep medicine. And what I think, perhaps more so than anyone, maybe in the world, bridges two worlds, sleep medicine and dental sleep medicine. And we can talk a little bit about the distinguishing between these kind of same but different fields between dentists and physicians. And recent author, published co-author of this book, Beautiful Faces, which talks about what I've talked about, kind of a semi-controversial topic that beauty, while subjective, is often a strong indicator of health. And when it comes to facial development, that couldn't be more true. So we're going to talk a little bit about sleep disordered breathing, and then one of the focuses that I'd love to talk about, and then I'm going to let you take over here, is adult expansion. And as Joe and I talked a little bit off before this, is one of the questions I get, perhaps more than anything else, is, hey, mewing has kind of gone viral on social media, and people do it for aesthetic reasons and facial development. And many adults contact me like, well, can this help me? And I'm like, well, yes and no. So we'll talk about the nuance of that, and we'll talk all about treating sleep disordered breathing and adult expansion. So how does that sound?
That sounds perfect. Yeah, thanks for giving me an opportunity to kind of talk about this book. It's trying to get more of the answers out there. People hear through the internets, all these sort of fad things you can do. And it's good to get some researched references that you can learn about this. And that's where the book's inspiration came from. So 2 years in the making. So with James Nestor's work with Breathe, Patrick McEwen with Buteyko, and of course, John Mew, Michael Mew's father, who really got the concept started, and then Michael Mew talking about the exercises, which is essentially myofunctional therapy, which we'll talk about later on.
Right. Exactly. And so I did read this book. It is, for those wondering, it's extremely broad. We could have a entire weekend seminar podcast discussing this book, if not more than that. And so It's very all encompassing. I thought we would focus on a section of it so we could just so everyone knows, when you read this book, it's going to cover a lot more than we're going to talk about today.
Yeah. And it's a great deep dive because people are passionate in your sphere of influence. They want to take control of their health trajectory, right? Through nutrition and functional medicine, biohacking, whatever you want to call it, which I am very much part of that tribe. So I'm part of the crew here. But this gives you all the pieces of the puzzle that fill in this whole really incredible zeitgeist right now. Everyone's really excited about it, but they don't really have a lot of tools. With James Nestor's book, he came out with, well, let's go mouth tape. Well, he had a lot more information in there than mouth tape.
That's right. Great book.
Great book. It got people thinking about that stuff. We'll talk about that too. But and with John Mew's work and Bill Hang and some of the really innovative orthodontists out there, they had different stories, but everyone walked away with, well, let's chew on some rubber and some hard gum,
Right, exactly.
Trust me, if it was that simple, that's all I would do in my practice, right?
Exactly. Here's some gum, we're done.
We're done. See you later, you're fixed, But yeah, I would love to answer the questions. And again, I want to applaud you on all the incredible work you're doing as a dentist in the field of sleep and pediatrics and nutrition. Big part of what my recommendations are going to be is, some of these factors that you're talking about. So good job. And thanks for working on that newsletter every week.
Appreciate it. So maybe one thing we can do for listeners is real quickly give them a baseline foundation. What is sleep disordered breathing? I think by now, people like James Nestor, like you've said, and these other people started to realize how important sleep is. And I think people drastically underestimate how many people are not getting good sleep, and probably a lot of listeners are getting less ideal sleep than they even realize. And so I think it's still kind of an unrecognized epidemic, but we do at least generally agree that sleep is very important.
We do.
Sleep disordered breathing is, I would say, one of the biggest, if not the biggest, disruptors of sleep. And so maybe you can kind of just give us a foundation. What is this? What's causing it? And then that can lead us into what can we do about it?
Yeah. So the hardest thing about sleep is the person doing it can't tell you anything about it. So if there is a sleep disorder, it's going to go a long time unnoticed because, again, you're unconscious. So all you know is how did you feel when you woke up and your energy levels throughout the day, and do you remember waking up a lot at night? It's very limited sort of metrics. So we're really blessed with all these new, neat sleep gadgets that give us some data, but they're not super accurate, right?
For sure, I agree.
I'll give you an example. I've been watching Aura for years and its development ever since Kickstarter back in the day. And I would get patients saying, yeah, my sleep looks pretty good, look at my score. And I would do a sleep apnea test and they had severe sleep apnea. Like, this score is not accurate. Right. If you are dying in your sleep, your Aura ring is not telling you you're doing well. And let's just explain that. So sleep disordered breathing is a spectrum, right? From mouth breathing, which everyone's talking about with James Nestor's book, to snoring mildly, to loud snoring that's disruptive to the bed partner, to airway collapsing frequently throughout the night. And that's what apnea means. Obstructive sleep apnea is you're sucking your throat closed repeatedly and getting pulled out of deeper sleep. Even though you don't wake up and remember it, you're constantly getting pulled in and out of restorative sleep to light sleep and never getting a full restorative sleep. And then your oxygen levels drop, your blood pressure spikes during these events, your adrenaline levels spike up there. So really, just to put it in plain terms, apnea is a confusing medical term for suffocating.
All night long.
all night long. And a mild case could be 5 to 15 throat closures per hour, 15 to 30 throat closures per hour, and then greater than 30 per hour is considered severe. Yep. And 80% of us are walking around not knowing if we have it still today. In children, it's probably closer to 95%.
Yep.
And a lot of us, it starts in childhood with poor facial development. So we have narrower airways, crowded teeth, hyperactive kids. Then you have adults where we assume falsely, stereotypically, you have to be a middle-aged, overweight male to have sleep apnea. Yes, that makes someone have a very severe case of sleep apnea. So you can tell they're exhausted, they're grumpy, their blood pressure's up, they're not happy. That's not due to the weight, it's due to the fact that their tongue has gotten so big. And I think you've talked about this too. Yep. We call it, I always give people a visual. So you start out at a normal weight, your tongue's more like a lean filet mignon.
Yep.
And then as you gain weight, it turns into a marbled ribeye steak.
Yep.
So mentally, you're like, oh, okay, that makes sense. It's fatty tongue. So essentially, the tongue gets so big and so heavy, the minute you fall asleep and muscle tone is lost, it collapses repeatedly, severely, and you're just wiped out, right? So that's sleep apnea or sleep disordered breathing in a sense. And it can do so many things. It can, make you feel fatigued and not rested. It can reduce your testosterone levels, your estrogen levels if you're a woman. It can increase your cortisol levels. So people are going to the naturopath and wondering why my cortisol levels up. Well, because you're not breathing and you're not sleeping. It reduces your exercise tolerance, increases the risk of high blood pressure. And it mimics a lot of things. So not everyone has the same symptoms, right? So one person might feel perfectly normal, and then you test them because their bed partner is just being driven up the wall because of the noise. And that is a real thing, by the way. Secondhand snoring is very disruptive to a bed partner. Fibromyalgia is much higher likelihood to develop in a female bed partner if they sleep next to a loud snoring bed partner. So noise pollution is a super big deal. So lots of people have it. Very few people are looking at it. It's hard to find it because it's hard to get into a sleep doctor's office. And the other thing that's really important is the branding of sleep apnea. Everyone, when you hear sleep apnea, thinks, oh my God, I do not want a CPAP machine.
Right.
Bad branding. No one who's working their butts off to stay healthy are going to be running for a CPAP machine. And that's true. 75% of people, if you gave them a retainer-based therapy and a CPAP, would choose the retainer over treating sleep apnea over a CPAP. And the sad truth is about 50%, if not more, of people who try CPAP can't tolerate it. It's the opposite of what we do. I joke with my patients and I tell them, people suck, CPAP blows. So physiologically, it's a totally different experience. So imagine you just have this rescue breather blowing in your face all night. And that's all these therapies are ways of doing CPR on someone who's not maintaining their airway.
Yep. You gave a good example in the book of it feels like, you're driving down the highway with your head out the window, trying to go to sleep. It's like, yeah, that's a good visual for, it's not easy to tolerate.
No.
A question that came to mind while we were talking a little bit about diagnostics, and you're like, okay, bedtime partner. A lot of time people go a decade with sleep apnea before they actually get in for a sleep study, and a lot of times it's a bedtime partner saying, "Hey, you're choking, you're not breathing in your sleep, and you're waking up choking." I think I've had a lot of hope for home, like smartphone based. I read about research out of Washington University. It was probably a decade ago that you were using sonar and getting good results with, detecting apnea, but still we don't yet have great like home diagnostics on your smartphone, but we do have home sleep testing. Of course, there's the classic PSGs. Any other kind of like recommendations of like someone that, all right, they might have a sleep problem. What's kind of the next step?
Great question. And there's lots of tools coming up. And the sonar stuff we were really excited about, but that all kind of fell through. Business, COVID. Yeah.
I don't know what happened to that. I was very, I've been looking at that research for a decade.
Yeah. So there's many ways of doing that. And partly what my mission is to make the sleep doc more accessible. So my role for dental offices and for patients in general is just to be a telemedicine doc. So that's solely my practice now. All telemedicine being easily accessible, getting access to someone in all 50 states. And the home monitoring equipment is getting smaller and smaller. So the first thing you can do right off the bat is download a free snoring app on your phone. There's several of them out there. And just listen to that noise. If you sound nasty and you're like sucking wind, and I jokingly tell everyone I'm a snoring ventriloquist or mimic there, because this is the only type of snoring that's not going to hurt you. It's a little baby vibration. It's almost cute,
Yep.
And then the one that's really protracted, and I got to demonstrate this. That's not very loud now. But it's effort. It's work. It's protracted. Your airway is the size of a little coffee stir straw. Try breathing through one of those during the day. You'll know exactly what you're doing to yourself, and you would never let it happen consciously on purpose. So noise is a good identifier. There's also smaller little units out here. I have a little demo. This is made by ResMed. This is a little sensor. Are you familiar with this one, Kevin? This is the Night Owl. It has a bunch of little stickies in here. It's Bluetooth, connects to your phone. And this is an actual HSAT. It's a FDA cleared level 4 study. And it can give us a sleep apnea score very easy. You can mail it out to a patient, have them do it for a few nights, get it back on a portal. Great, simple way. Now, is it totally comprehensive? No. But it'll catch the serious cases, the moderate, the severes. There's a consumer product out there right now, which I've been pretty big proponent of them for a long time. It's called Circle, CIRCUL. It's a ring, just like an Aura, but it's expandable, so it can go in different finger sizes. And it actually gives us pulse oxygen levels that are medical grade. So it's a per second scoring, and it gives us what's called an ODI, or a type of way of telling you your apnea score, right? So AHI is the classic way, apnea is throat closure, hypopnea is narrowing, index is per hour. Remember I told you 5, 15, and so on. ODI is kind of like that. So if you have an ODI, assume it's like your apnea score. Right. So it gives you actigraphy, so you can kind of know what your sleep scheduling sleeps like, and then it gives you heart rate variability, which is kind of like the new metric, right? For are you rested? Are you recovered? Yep. Let's face it, we work out really hard. We want to recover from the workout. We just don't want to do it for no reason.
Yep.
And that's why you work out, is to recover and get muscle growth, right? So simple ways like that consumer product, the Circle, the Night Owl. A lot of our dentists now, like yourself, very much likely, are getting the training in sleep apnea and are acting kind of like an extension of the sleep doctor. And a lot of my clients are dental offices who've done training because the American Dental Association is asking dentists to do more training and more screening, because there's a relationship with bruxism or grinding and sleep apnea. There's a relationship with TMJ and headache and sleep apnea. And your dentist is the one provider that can catch you while you're still young, because you're going to see them before you have disease. So they're a super big partner in being able to access home sleep diagnostics. And the only challenge here is because dentistry in 1960s decided to stay way over here due to Medicare reimbursement, and medicine over here, we think arbitrarily like they're two different things. So you've chosen to be in this certain area of diagnostics, and medical's over here. This is the first time that there's a nexus. So I'm kind of like a glue. So if a dentist is looking for this in screening, I'm that glue to help do the interpretation, the medical prescription, and help the dentist get access to the patients to continue their treatment planning, which we haven't talked about yet. But that's another great way of just finding a dentist in your area who's been trained, who's going to help you get access to someone like me. Does that help?
I agree. And I think all dentists should be doing it because, I mean, you look in the mouth, you can see the scalp tongue, the fatty tongue, the bruxism, the malum patty, and you're just like, you can, and in pediatrics, you see the tonsils, the adenoids, the open mouth posture, the narrow arch, the crowded teeth. Like, there's so many symptoms that like a dentist should be able to see and recognize in a glance to be able to refer for a sleep study, or to an ENT or a sleep doctor or whatever it might be. But I feel like you said, people are going to the dentist. We can catch them early, and so
and you need to see it.
A place to start.
Yeah. I mean, and you're trained to do great work here. If we just tell you, hey, just look a little bit past that.
Exactly. Just a little deeper.
A little deeper.
So while we're talking about kids, real briefly, because I'd like to focus a little bit towards the adults and what they can do, but like I just said, we see pediatrics. I see a kid, they got big tonsils, they got this narrow arch. I'm like, and I'll often, be telling parents, I'm like, I think they should get a sleep study based on all these symptoms I'm seeing. And one of the biggest symptoms is like this crowded arch. And so what John Mew kind of, I'll say more or less pioneered was orthotropics is what he calls it, but it's basically expansion, early intervention. And so there's things like MyoBrace and Healthy Start. Anything else you'd like to mention among like things parents could consider for their little ones?
Yeah, the first and foremost is breastfeeding. Breastfeeding, we understand, is really great for nutrition, but it's actually the best workout for your tongue. It's the mewing. It is the granddaddy of mewing. And with the vast majority of facial development happening prior to the age of 2 and kind of stopping around the age of 8, right? You can get 80% more trajectory of normal growth and development of the face if you're breastfeeding. Now, it's hard because up until recently, the average kid would probably breastfeed to some extent until about 4 years old. So lots of mewing, right, in that kid.
Yep.
And so that's important. Integrate that. Find ways to surrogate that, like the MyoBrace, these habit-correcting, non-custom mouthpieces that your dentist can kind of measure the intermolar width and get you on track with that. That can kind of help you if you can't get all that breastfeeding out of the way to get the tongue strong. Also harder foods, not the mush, not the baby, food in the can, in the little jars. It needs to have some strength to that. Those kids have to kind of wean themselves onto, firmer foods to strengthen those masseters. Looking for tongue tie. One of the most common congenital problems in modern humans is the frequency of a tongue tie, so the tongue's not able to get into the roof of the mouth. So watching for that upon birth and in early baby visits there. Posterior tongue tie means a lower tongue posture. And that's usually in kids who are not great nasal breathers. So if they're having a lot of allergies, or if they're at daycare a lot, they're getting a lot of upper respiratory infections, they're learning to become mouth breathers. So helping them to avoid becoming not mouth breathers and improving their ability to stay consistently nasal breathing is, again, is the most important part of mewing, right?
The tongue is probably the most under-recognized, most important part of this whole equation. And one thing that I am unfamiliar with, and maybe you could shed some light on it, is it seems like a tongue tie. Like, what is the fundamental cause of this? Because I would think that should be an abnormality from an evolutionary biology perspective, like getting that tongue in its proper position is very important, as you discuss in the book at length. And so I'm not sure, like, the cause, the frequency of these tongue ties. I hear about them a lot. That's not my area of expertise. I would love to learn more.
I can't quote you right now, but it is the most common, and it's considered congenital abnormality. So so people think of cleft lip, cleft palate. This is a type of congenital abnormality like those, but not as severe aesthetically or growth and development. So Mother Nature, it can be very tough on us, right? And luckily, due to technology, clean water, antibiotics, surgery, all sorts of cool advancements in modern health, I probably wouldn't have made it past childhood with a tongue tie. And a couple of other generations, right? So what we have to understand is we're allowing a congenital abnormality to become more regular because it doesn't impact growth, healthy growth right now. But we're not taking that into account in facial development. So just be aware that even in the womb, many of us are growing with tongue ties. And now remember, as a gestating infant, gestating baby in the womb, they're already developing a poor tongue posture.
Yep.
So their tongue swallow is not appropriate. So that's why there's so much crowded teeth. The tongue's just not in the right position, breastfeeding, all these factors. Now, we can get past this as long as we're aware of it, and then we can implement strategies to help us get back on track. But right now, the awareness is there's such a dearth of awareness that no one talks about it.
Yep. So it might fall under that category of epigenetic milieu of facial kind of inadequate growth, because some people I know, they breastfed great and they weaned onto good appropriate food, and they still have crowding and things like that. And there is an epigenetic component where you do everything right, you're still going to have to take some likely corrective action to get to what your full genetic potential may have been. And you talk a lot about that in the book.
Yeah.
If we can kind of segue to adults a little bit, and one of the reasons I want to talk about expansion is because a lot of times we're talking about mewing, and mewing is all about getting the tongue to the palate, proper sealing of the lips. But really, that tongue to the palate is the critical thing. And I suffer this still to this day, a narrow arch, and my tongue fits to the palate, but not easily. And I know if I had greater width, I could get greater suction with the tongue, especially when you're sleeping. So if you wake up in the middle of the night and you realize, that tongue fell off the top of it needs to be plastered to the palate throughout the night. Keep the airway nice and open. But even mine I'll wake up and it fell down. And that's one of the biggest things about the expansion. It's going to increase the size of the palate. You put your tongue up there, opens the size of the airway, and that's combating a lot of these sleep problems in itself. Is it basically, I explain that right?
Absolutely. I know there's a lot of talk about skeletal expansion, right? And so a newer technique is maxillary. Basically, you're implanting screws into the roof of the mouth, and you're putting the expander on that versus resting against the teeth. And there's some really neat and hopeful progress happening there. It's still very early on. So there's simpler things we can do before that for a lot of us, right? So we need a minimum intermolar distance to have good tongue posture. So if you don't have around 42 millimeters-ish in an adult, it's going to be hard to mew. It's going to be hard to keep that there. So what I've been focusing on, I always look for the low-hanging fruit, because I like to call myself an efficient patient. Some people call that lazy, but it's efficient, right? I want to do things simple, straightforward. So the reason why I'm wearing Invisalign right now is there are some less invasive techniques that we can help to achieve some of that. So simply by taking your teeth, which a lot of us are either lingualized, so your teeth are leaning in toward your tongue, pressing against there, you're not realizing your potential intermolar width. So with newer Invisalign techniques, you have to go to the right dentist who's focusing on airway, not your traditional orthodontist who's just doing straight front six, lining and IPR. And for the listeners, IPR is kind of, sandpapering the teeth, so thinner, so you can move them together, right? So you want to have arch expansion, and there's some great thought leaders in there, Terry Coddington, Jeff Skinner. They probably read about them in the book. But they're in their computer, the ClinCheck, the way the dentist makes the decisions on where your teeth move, in the ClinCheck tells us to take the narrow arch and round it out. Take the teeth leaning inward and straighten them up. You could get probably 30% of that change just by that. And you'll intrude some of the teeth appropriately because you want the mandible to rotate forward. Yep. And if you can intrude some of the molars with that Invisalign, you'll have the mandible naturally rotate forward, and now your proximity of your tongue and your soft palate are closer. Right? Yep. So by arching and rounding and intruding some of the molars a little bit, now you have a less distance for that tongue to reach upward into the roof of the mouth. And that's why I waited until my late 40s to do this, because before that, it was just straighten teeth out. No, this is airway development.
Yep. And so for the listeners, what you're talking about is this is not palatal expansion. This is just orthodontic move, basically spreading the back molars out, which in essence will give you more room to put that tongue on the palate where it needs to go, instead of a more narrow, which is, what I'm suffering with is not enough room. And so widening the palate, which we can also do, like you said, you put screws up in the palate and basically a palatal expander, more or less, to do that. Maybe the low-hanging fruit is just to move the teeth, and that, like you said, maybe that's
absolutely. Because think about this, a lot of the movement you can do with the aligners or braces is this part, right? So if I do scale expansion, I'm working on this back section, so I'm moving that back part. But if you're already like this, you're not giving your tongue space to sit forward, right? So by doing the orthodontics, you're going to round out that area so the bicuspids and that region is more rounded, and you have more potential tongue space to set forward also. It's not just the lateral, but as how easily do we help the tongue set forward? Yep. And so some of this really big excitement about MARPE and DOME and some of these other procedures is a bit too much for your first foray into this. The first foray is nasal breathe. Right? Work really hard on Buteyko, listen to Patrick McEwen, start using some clear spray every day, reduce infections. This is a great product that Dr. Downs makes called Hyponasal. It's a disinfectant that your body makes. It's also anti-inflammatory. So your body makes HOCl to kill all viruses, bacteria, prions, and mold. For millions of years, every macroorganism's white blood cells make that, and it'll never become resistant because it will, it never will. So HOCl is a safe chlorine molecule that your body makes, and if you spray it in your nose, it reduces inflammation, reduces the risk of getting an infection. And if you wash the nose regularly with clear, you're doing what's called nasal hygiene. So the membranes in the nose need to be moist, just like the membranes in your mouth. If they're dry, they're going to be inflamed. So you won't be able to use the nose. And of course, then you start looking for indoor air pollution quality, HEPA filtration, allergens. If you're, prone to seasonal allergies, get immunotherapy, maybe get on some, after you do the nasal hygiene, then maybe do some antihistamine or some localized nasal antihistamine sprays. Get the nose working better. And then finally with the nose, and you're an expert in this, Dr. Stock, is that you want to dilate that nostril too, okay? So Kevin has been putting a lot of work into this, and I love nasal dilation. If you look at my nose, it's fairly narrow, and it wants to collapse on the outside. So when I breathe in, you'll see it collapse. That's what happens in sleep.
Excellent demonstration there.
Yeah. Done it a couple times. and so you want to support this nasal area here, so when you breathe in, you have better airflow, so you're not pinching the straw externally. So Kevin has worked tirelessly on his own version of how to improve nasal dilation, so you'll use your nose. Then if you hydrate the nose, it'll stay less swollen on the inside. And then there's even some laser therapies that we can use for other aspects of nasal dyspnea. So you've probably talked to your listeners about nasal dyspnea a little bit in the past, I'm guessing.
A bit.
With your liner. So nasal dyspnea is you feel like it's hard to breathe through your nose. Well, the back of your nose is your soft palate, right? So your soft palate and your tongue is what causes snoring down here. If your nose is plugged, this will vibrate more. That's where the nasal plugging and soft palate comes. But if your soft palate gets sucked back to the back of your throat, it feels like it's hard to breathe through your nose up here. So we actually have a laser therapy that we can laser the back throat non-surgically to firm up that soft palate to also improve nasal breathing and snoring. Lots of cool stuff coming down the pipe.
That is, one of the things I've worked on nasal breathing for years, and I've gotten pretty good at it. But even today, when I'm doing high intensity kind of training, I can maintain nasal breathing. But what I always have to do is almost squint my nose up like this to open it, because I get that nasal valve collapse whenever you're breathing hard.
Yeah.
So, stunting that nasal opening, if it has a tendency to collapse, is, one, for sleep, but two, also in the exercise realm.
Oh, absolutely. And that laser I told you about, it's called night laser, where we do laser therapy of the soft palate and the tongue to shrink and tighten those tissues. I like to call it like rejuvenation of the airway. And the DECA quiet night laser kind of does something very similar, which is another laser that you might find in a lot of dental offices. It's non-surgical, so there's no downtime. There's no pain, there's no bleeding, there's no pain medication. And immediately afterwards, the dilator muscles in the back throat also get kind of stunned from snoring over the years. So you're supposed to dilate the muscles in your throat when you breathe in, as well as your diaphragm and your intercostal muscles. So a lot of my high performing athletes find that they have a better VO2 max because those upper dilator muscles are actually waking up and functioning better, and they get better nasal flow by that laser as well. So not only are you sleeping better and recovering better, but your daytime nasal flow is improved. So that's kind of the important part. And in those cases, you probably do need to wear like a exercise marketed nasal dilator. Like the Mute has like a yellow version that you kind of wear in your nose if you don't mind people staring at you weird, right?
Yep. I think what you said there is really important, because a lot of these treatments, which I think that when we wrap up here, we talk about some of these treatments. But one of the things about expansion or the lasers are, that there is like an annual kind of like refreshing, I'll call it. But like with expansion is like you actually solve the problem. Like,
sure.
Right. So we'll talk about some of these things where you got to put this thing up your nose, put this thing in your mouth, put this CPAP mask on here. It's like, it's treating the problem, but it's not necessarily solving the problem.
Yeah.
And when you solve the problem, it's better breathing, not only when you're sleeping, but also, every breath throughout the day as well. So 24/7, which is a nice ramification. So maybe we get into a little bit of application. So someone we recommend, start with a bedtime partner, maybe one of these snore apps, something like that. And then if you're high risk, you get a screening. Sleep doctor like yourself with telemedicine, dentist trained in it is a good place to start. They will likely, if high risk, send you a HST, which stands for a home sleep test, which is kind of the go-to thing these days. I'm sure they still do PSGs, which is the formal in-lab things. But one of the things that you mentioned earlier was like it does. The HSTs don't have, I'll say all the bells and whistles, but a lot of times it's a more accurate representative night of sleep, because you're sleeping in your own bed. And whereas if you go sleep in some foreign bed hooked up to all these wires, it might be a more accurate test or a more inaccurate actual night's sleep. So to the treatments, let's start from kind of like the least invasive to like the more into the weeds. And the first one, I would like your thoughts on mouth tape.
Yeah. Mouth tape was very easy buzzword for the book, but it was the least important intervention. Nasal intervention is more important. Nasal hygiene should have been the buzzword, right? Washing the nose, dialing the nose, that's the more important thing than trying to mouth tape. Okay.
And your HOCL product, how twice a day? What do you?
So you want to start off with the clear, a couple squirts of clear. It'll hydrate the nose. You'll notice immediately your nose is going to run because it breaks up biofilms due to the xylitol. Blow the nose, and then do a couple squirts in each nostril of the HOCL a couple times a day. Both of those should be at least a couple times a day, because you're hydrating when you wake up, and you're hydrating when you fall asleep. If you're traveling a lot, remember this: 80% of upper respiratory infections start in the nose. And if it's a viral infection, it'll take about 5 to 8 hours until that virus touches the membrane and actually infects you. So if you can get in the habit of washing the nose and cleaning it a couple times a day, you are less likely to get an infection, even if you get exposed to an infected person. See what I'm saying?
Yep.
So, based on if you're traveling a lot, if you're shaking a lot of hands, you actually, hit your nose and you've had 18 handshakes that day, you've got some dirty hands there. Right? So those are the two things you're trying to avoid. And of course, if you have good nasal flow, great. If you collapse like me, nasal dilator at night. Most important thing. Mewing is, again, being aware of having good posture, head up, tongue pressed up in the roof of the mouth, doing some exercises. The simple ones that I tell people to do is swallow with your tongue between your teeth. You'll feel the back of your tongue lift up. Do that 10 or 20 times a day. That's way better than biting on weird rubber stuff and whatever to get your jaw muscles to get big.
I like that.
It's simple. It's simple. The other one is to make a noise with the roof of your mouth, like this. If you can do that, you have a pretty strong tongue. And I've been doing it for years. And I cheat a little bit. I use something called Excite OSA. Excite OSA is a little unit here that plugs into this guy here. It's a prescription for mild sleep apnea and snoring. And it basically goes in the mouth and pulses your tongue with these little sensors here like a workout. So that tongue is going to be stronger. Within 6 weeks, you can actually treat snoring and mild sleep apnea by making that tongue tone more effective, like what you're trying to do with mewing, but with science.
I like that a lot. I do like that. One of the things I do find, I have a hard time tongue clicking because of the vaulted palate, and that goes back to the craniofacial development. But it's not to deter people from practicing. You can still make progress.
Absolutely. You always practice this, and it doesn't hurt. You're combining things to work best, right? And I do this every day. I do 10 of those tongue knocks. And every day you do it, you're going to start off like this. And every day you do it, you're going to get better and better. So that gives you a mental trigger that, I'm getting somewhere. Yep. Another thing to improve tongue posture, like you said, MyoBrace, Vivos has their own device with Snore Pillow. Healthy Start. There's a new device out called an iBreath. I love this thing. This is essentially mouth tape that works. This goes underneath your lips, and this goes over your tongue. Want me to demonstrate it?
Yeah.
Okay. So you'll suck on it. That little pressure in this little space here pulls the tongue into the roof of the mouth, keeps your mouth closed, and so it's going to train you to like that sensation of your tongue being in the roof of your mouth. I'll have Dr. Down send you one of these to try out, Kevin.
I would love that because
it is the right way to keep the mouth closed because you are keeping the lips together. You're exercising your lips by maintaining that seal. It's part of myofunctional therapy, strengthening these muscles here. By sucking on it, you generate suction so that the tongue gets in the roof of the mouth, and neuromuscularly you get used to that sensation of your tongue up there. And that little bit of suction also improves the back posture of your tongue. So it's called iBreath. And if you want, we can put some links up there. It's like $40. You wash it, you reuse it. Awesome.
Definitely put links because maybe this is a good place because I know we're running out of time here. Is